Hi, thought I'd make this quick video. Might not be as quick as I think it's going to be, but just kind of explaining where I'm at, what I'm going through. Recently, have been diagnosed with cervical stenosis, and so cervical stenosis is narrowing of the spinal cord chamber. I also have myelopathy. This is spinal cord compression, and I have radiculopathy. So a couple opathies going on there, which is the pinching of the nerves. And so what does that look like? I'll show you. So basically here is a normal spinal cord, I guess I should say spinal cord top here. So you understand what you're looking at is the head. And then this is the spine in the neck area. Right here would be the Adam's apple. Um, and so here's what a normal spinal cord looks like, right? And what I mean by normal is if you look at my spinal cord here on the left, so you can compare. A normal spinal cord has this white fluid going through it called spinal fluid, and so as you can see, that's surrounding the spinal cord. There's a certain amount of space in between the bones of the vertebrae in your spine, compared to the space that you have around your spinal cord. When you look at mine here, you can see it's normal up top and starts to get pinched right about here, and then gets pinched worse and even worse going down a few levels. And so that's what I've got. What happened was is I thought I had torn my right bicep because I had lost significant strength in my right bicep. I work out fairly consistently, and all of a sudden, I couldn't lift. I couldn't lift more than 10 pounds on my right bicep. A week went by, and I couldn't lift more than 5 pounds on my right bicep, and I'm doing up to 40 pounds on my left bicep. Good 8, 10 times. And so I thought I injured it. So I went in. My primary care physician thought that I had torn my bicep. We did some x-rays, we did some CT scans, ultimately did, uh, MRIs on my elbow and arm. And my orthopedic doctor said, let's go ahead and look at some nerves because he didn't, after doing some drills on me, he didn't think it was my bicep at all. And so he took an MRI of my neck area, and sure enough, we were able to see, what was going on. And, he further explained to me, that the symptoms that are tied into what I've got, are stuff like numbing of the hands and arms and fingers, tingling, loss of strength, even with walking, balance, unable to balance and walk in a straight line, kind of like you're intoxicated. Also motor skills, right? Like the ability to pick up little things and be coordinated, as a normal person would. So again, the big thing that brought me in to get this looked at was a sudden loss of strength, in my right arm, and even my right shoulder. And so this is where, this is how I got here. And as I've gone through this and I start to wrap my head around this, and as you're going through something like this, you do a lot of research, and I start getting really familiar with the symptoms. I realize that I've had a lot of these symptoms. I've just chalked it up to different things. And mind you, I go to the doctor. I'm borderline hypochondriac. I like to say I'm well maintained. I've got a primary care physician. I've got a pulmonologist. I've got a cardiologist. I've got a physical therapist. I'm sure I'm missing a couple, but I'm that guy that gets my blood work done every 6 months, and I mark on my calendar when the next 6 months is, and I'll contact my doctor and say, hey, 6 months is up. Put my blood work in at Quest. I'll go take them, and we'll do our follow up. And I follow my numbers. I'm a data guy, so anytime something's wrong with me, I'm constantly, using my insurance, and I'm going in and I'm getting looked at. I like to get there's nothing wrong with my heart, but I like to get it looked at every year. And so anyway, I say that to say I'm fairly on it when it comes to, my physical condition. But as I've wrapped my head around what I've got and I start looking back, I want to say my symptoms got severe, or started to get really noticeable, probably about 5 years ago. Started with some ringing in my ears. I think back that was the first time. It was in 2017. So ringing in my ears, and even though I work out a lot, I did notice that my right arm had less strength than my left arm, and I just chalked it up to I had surgery in my right wrist when I was in high school. I had fractured a wrist my freshman year, but didn't know I had fractured it, and went to get it fixed my senior year, and it was an old fracture. And so I went on for 3 years with a broken wrist, to find out that it had been broken for 3 years. They had to put some pins and needles and do all kinds of stuff. But I just chalked up my weakness on my right side to that. I also have had shoulder issues on the right side. And they said I went in and got looked at, and they said I had a light labrum tear, but nothing that needed surgery. So I've always chalked up a lot of my symptoms to a bad right side, my wrist, to a torn labrum. And I've always had this pain going down my neck out to my right side. There's been times when I'm driving from LA to Fresno, and I mean excruciating pain where I like literally wanted to pull over and like lie on my side to relieve the pressure. Anyway, I just share all of this just to kind of give you guys an idea, what I've been dealing with, and all these little things, are really starting to add up. Of late, I've started to notice I've gotten really dizzy, which is tied into the balance that this thing does, and getting really dizzy, and I felt like it's gotten worse fairly quickly. This at around the same time that I started losing strength in my right bicep, and that was about October 2022. It is now March of 2023. And so it's been, a few months now since I've had this issue with my right side and the strength, and I'm starting to see these other symptoms, really close in on me. So I have elected to proceed with the prognosis, and the prognosis is to do what they call an ACDF surgery. Uh, ACDF stands for anterior cervical discectomy plus bone fusion. And so it's a pretty, I mean, I guess it's invasive if you've never seen it before, but compared to other spinal surgeries, it's not that bad. Um, Again, being a data person, I started doing my research, and, I definitely want to get this fixed. But of course, there's all these things that you worry about. And so just to kind of put things into perspective, I think a lot of us are familiar with folks who get hip surgeries. Hip surgeries are fairly common, right? As we get older, I think as a nation, we're doing 400 to 500,000 hip surgeries a year. Okay. And so when it comes to the ACDF surgery that I'm getting done, they do a little less than half of that. So it's not as common as a hip replacement, but it's not, something that they do rarely. It's done quite a bit. Um, and typically it's they're removing one, two discs, maybe three. In some cases like mine, they are actually doing all four. And again, there's an animated video that I'm putting in the link of this video that you can click on the top right. If you want to click on that, and you can watch a 1.5 minute video of a 3D animated of what they're going to do. Just for a warning, it can be a little. It's not necessarily PG when you're looking at it, but it'll give you a good idea of what I'm doing. So anyway, that's what's going on. I go to surgery here at 5:30 in the morning. It's 5 p.m. right now, so I'm looking forward to coming out stronger and better than what I did when I went in. Um, but that's where I'm at. And if you have any questions, feel free to text me. Let me know. Talk to you soon. Thanks.